Item 28 is a proposed amendment with, proposed agreements with the Arvin City Police Department in the amount of $700,000, the Delano City Police Department in the amount of $700,000, the Shafter City Police Department in the amount of $700,000, the Wasco City Police Department in the amount of $250,000, Clinica Sierra Vista in the amount of $1 million, and Kern County Hospital Authority in the amount of $1 million, and a memorandum of understanding with the Kern County Office of the District Attorney in the amount of $660,000 for participation in the Fentanyl Misuse and Overdose and Prevention Task Force from July 2016, 2024 through January 1, 2026. Ms. Martinez.
During the fiscal year 23-24 state budget, Assemblymember Dr. Jasmeet Bains secured $10.5 million for a fentanyl addiction and overdose prevention task force in Kern County. Dr. Bains has been working with staff in the county administrative office to evaluate proposals submitted by many organizations in the community. The items presented for your board consideration today represent the collaboration of local law enforcement agencies and healthcare providers to address the epidemic in our community. And it is also the beginning of this task force that will address silos in combating fentanyl. Fiscal policy analysts Joseph Arreola and Julia Carlson have been working with each of the agencies to develop the proposed agreement for your board's consideration this morning, and they will provide you, your board, and the public with a very brief overview.
Morning, Mr. Chairman and members of the board. Part of the funding that is being approved today is for our partner agencies with city police departments, the Kern County District Attorney's Office, and in cohort 2, we will later see the McFarland City Police Department, Kern County Sheriff, and Kern County Probation. Funding for partner cities will be used for training, equipment, investigation and specialized units, the hire of crime analysts for data gathering, analysis, and reporting, and the establishment of education and community support divisions to raise public awareness and encourage community support for individuals facing these challenges. County agencies will use funding similarly, with the addition of laboratory and toxicology testing for fentanyl, xylazine, and similar synthetic compounds. All agencies will be working in a coordinated effort with the local task force and healthcare partner agencies to promote comprehensive strategies, enhance resource allocation, and foster a multidisciplinary approach to problem solving.
Thank you. Chairman, members of the board, I'm going to present to you a little bit on our partner agencies within the healthcare agencies, as Joe briefly mentioned. Within today's agenda, we're asking for approval of the agreements with Clinica Sierra Vista and Kern County Hospital Authority. Both of these will expand healthcare workforce and increase access to street medicine. Both will expand street medicine by extending services beyond the traditional clinic setting. Kern Medical will be expanding services within shelter sites, and Clinica Sierra Vista will be expanding their street medicine team, increasing access to substance use treatment. Both of these will be providing services to marginalized populations and individuals experiencing homelessness. These programs will broaden the geographical reach across our county. In addition, Clinica Sierra Vista will launch an addiction medicine fellowship program equipping healthcare providers with the specialized knowledge and skills to provide a comprehensive care to those battling addiction. Kern Medical will expand their fellowship program, increasing the addiction medicine services through additional inpatient consults and outpatient clinic services. On the screen, you can also see cohort 2, which will include partnerships that are in the works and will come before your board at a later date. These include funding for expanded access to medical education and expansion to a medical detox program. Now, you heard us speak on multiple partnerships and their individual agreements. Now, this flow chart that you see on the screen is intended to be a visual representation of how these various partnerships are working together for a comprehensive task force approach. On the left, it shows the referral sources on how individuals typically will first enter into the flow of this task force. The referral sources include hospital emergency departments, including Kern Medical, mobile crisis response and law enforcement, including our multiple law enforcement partners that Joe mentioned, and homeless outreach, including the expanded street outreach teams through Clinica Sierra Vista and Kern Medical. Moving to the next gray box on the screen is the medical detox piece, which, as mentioned, we're working through the details on that and will provide more information at a later date. However, this is an integral part of this flow through the fentanyl task force. Moving to the green sections are various levels of care within residential treatment centers and sober living environments. And then on to outpatient treatment, which includes partnerships with Kern Behavioral Health and Kern Medical's fellowship expansion. The final box on the left shows individuals that have graduated to recovery services and are continuing with community supports. This includes all of our partnerships in various ways. And then over the top of this flow chart, you see an education piece. This is an overarching piece of this task force that all agencies will be involved in some way. The education will include to our specialized workforce within the law enforcement training, medical training, and then also a community outreach and community education piece as well, which, as mentioned, all of those agencies will have a piece of. And then the last piece that's not shown on here directly, but is incorporated throughout the whole thing, is a data collection and analysis piece that through this task force, we'll have quarterly meetings with all of these agencies, collecting data, analyzing that data, and then through these quarterly meetings, doing a little check-in with everyone, see how everyone's doing, how these programs are working, and then making adjustments as needed. So I hope that this flow chart is helpful to show that all of these individual agreements are not siloed individual projects, but really all come together for this cumulative task force. And that concludes my remarks, and I'll pass it back over to our CAO.
So the recommended action for today is for your board to approve the proposed agreements and authorize the chairman to sign. Assemblymember Bains is present and would like to address your board in this very historic opportunity to bring collaboration between our law enforcement and our healthcare partners.
Thank you to Julie and Joe, Juliana and Joe and Elsa for working on this. We've been working on this for the past 6 months almost, getting everything together for this task force. It's been great having them on board. They've done such a great job. Thank you to them. Thank you to Kern County for allowing this opportunity. For me, everybody knows, as a physician, as an addiction specialist right here in Kern County, fentanyl is something that I have been working on for very many years. I first witnessed fentanyl ravaging our community when I was working in Taft as a lone doctor out there in a FQHC. And at that time, that inspired me to get my primary care psychiatric fellowship and my addiction certificate as well. After that, I joined Bakersfield Recovery Services as a medical director, increasing resources for people suffering from addiction. After that, I continued on and got elected to the state assembly. And my very first bill that I introduced was AB 33. I got sworn in with one hand and I slipped my very first bill with my second hand. And it was AB 33, which was signed into law last year, along with AB 33, which establishes a statewide task force within the Attorney General's office. We were also given an extra allotment of $10.5 million for Kern County to get started. This was an investment from Sacramento in Kern County, specifically because I was trusted for my expertise in addiction and making sure that there are people that are going to be responsibly using this money to make sure that we address the problem of fentanyl. There is nothing funny about the fact that people are dying from fentanyl daily. There is nothing funny about the fact that I have had to hold the hands of kids that have seen their parents die, or parents that have seen their kids die. There is nothing funny about the amount of fentanyl that we have seized in this county. There is nothing funny about the fact that law enforcement works day in, day out to keep our community safe. How about our healthcare providers that work day in, day out to increase medical innovations, to make sure people get access to treatments? The biggest problem is you have people on one side and the other side saying, all we got to do is lock everyone up. We got to increase treatment. It's both. Hold people accountable, get people access to treatment. The $10.5 million was split right down the middle. You had half go into law enforcement to create protocols for education, for more data analytics, for machinery and data, things that can allow better analysis and capture of drugs that are hitting the streets. The other part is the $5 million piece, which is going to healthcare to provide resources for people that are suffering from addiction, making sure that we have more and more research and innovations and access to treatments. The problem of addiction is something that has been created, and we must address it with both. This is, as Elsa said, an historical amount of money that's been invested in Kern County. Nowhere else in the state have you seen this investment. And this is because Kern County elected the first addiction specialist to office in California. This is a direct investment because they believe in the work that I am doing, and they believe in the work that Kern County can do to lead the way on combating drugs. This is also a first step in combating the new emerging drugs. As everybody knows, we have xylazine on the rise, tranq, we have carfentanil hitting the streets, which is 100 times more potent than fentanyl itself. We have to get a handle on our drug crisis. Super honored to be here today. Thank you again, Elsa and Julie and Joe, for all the work that they've done. This is the first step. We're going to continue creating more and more protocols to make sure that this program gets implemented, and I look forward to taking the results of this task force to the state with the Attorney General's office to also implement AB 33 at the statewide. Kern County will lead fentanyl task force for the state of California. Super amazing honor for Kern County to be here to lead. Thank you guys for having me, and thank you to all of the members of the task force.
Thank you. I'll return it to the board and ask for a motion.
I'll make a motion to approve.
Second.
Please cast your votes.
The motion is approved. 3 ayes, 2 absent. Supervisor Flores, Supervisor Scrivener.
Thank you.